over the very recent past. It first began to be identified in the UK, and it was roughly maybe about 2 or 3 weeks ago, and we hadn't seen any cases here in the United States. We actually had our first webinar alerting health providers to this emerging syndrome on May 1st, recognizing that something which is potentially presenting in an atypical fashion needs to be reported to the health department. And Kawasaki's is a rare illness to begin with, but when it presents atypically, that's when we need doctors, whether it's for this syndrome or for others, to report to us.
Now, as of today, there have been 38 cases detected here in New York City. That's up from 15 at the last count. There are 9 more cases that the specifics of the case are still pending, meaning they're still making an evaluation to determine if it is this syndrome or not. Now, of the cases that have been verified, 47% of the kids involved tested positive for the coronavirus at that point. Of those who tested negative, 81% had the antibody, so had been exposed at some previous point. So that's telling our doctors and our scientists a lot. This is something we really need to focus on and address. We have lost one child in New York City, and so we now are going to make a major priority of addressing this. A set of new actions are being undertaken. At our public hospitals, at health and hospitals, all facilities will do antibody testing for all children with the symptoms, with fever, with abdominal pain, gastrointestinal symptoms. That will be done across the board. That guidance is being given to all pediatricians in New York City, calling on all hospitals, not just public, but all private and independent hospitals to do the same, to start immediately administering these tests when you see these symptoms. Our medical leadership, our health leadership, Department of Health, Health and Hospitals, convening pediatricians from around the city on a video conference to analyze more of this information and learn more together what's going on. We're sending a health alert to the parents of more than 1 million public school kids to put them on alert of this challenge and make sure anyone who sees these symptoms in their kids gets health care immediately, reaches out to their doctor, or gets their child to health care immediately. Also, obviously, although our schools are by and large shut down, we do have our regional enrichment centers for the children of essential workers. All regional enrichment centers are being instructed to increase enforcement of the use of face coverings and masks and the use of hand sanitizer. If you see these symptoms, take them seriously, act immediately. This is a real problem, but it's a problem that can be addressed if it's caught early.